A new study commissioned by the healthcare firm Bupa explores the economic cost of major life events like births, divorces, and the death of loved ones. Now, the study looked at more than 13,000 workers and how those major events affected their well-being and, key here, their productivity. It estimated that these events contributed to 1.7 billion working days lost each year and put the cost at about $636 billion. The study says that providing more mental health support could reduce that cost by $42 billion. Liam Daly is a senior economist at the Center for Economics and Business Research, which did the economic modeling for this study. I want to welcome you to the program, and I'm trying to quantify this, and it is insightful to just kind of learn what the numbers look like. What were your findings, and did they surprise you, either qualitatively or quantitatively?
Yeah, so as you mentioned, we conducted a survey of 13,000 workers across 4 different markets, and we were really trying to understand how people's health was impacted by these major life moments: divorce, marriage, losing a loved one, becoming a caregiver, returning to work after having a child. And what we found was there was significant impacts, particularly on people's working lives. And as you mentioned, this comes with a sizable economic cost. So we found that in the US alone, these costs amount to 167 billion, equivalent to 250 million lost working days. What was quite surprising was that while a lot of people recognize and see the signs of these mental health impacts, a large number of people don't act on them, and where we start to see some of the mental health impacts really taking a toll on people's ability to maintain their working lives, and also maintain their daily routines.
And some people feel that they can't act on this. Now, the findings, you say, point to a key factor given the cost, and that's preparation. I'm wondering what that looks like for people who don't have, let's say, Bupa insurance in their daily lives.
Sure, and I mean, there's a variety of ways that people can act to try and mitigate these mental health impacts. It could be informal actions like speaking to friends, looking online for support groups, or it can be more formal actions like joining a support group or going to speak to a GP. But what we found is that people who take no action often suffer the larger consequences when it comes to their mental health and their ability to maintain productivity in the workplace.
And again, maintaining that productivity in the workplace many times, goes to you keeping that job and job security. What would you say to employees and employers about the responsibility of this? Because, if I break my arm, you can see it. Paula has broken her arm. She clearly is incapacitated. The other things people don't see, do you believe disclosure is the best thing?
I think that's very true. Like, people don't necessarily, these mental health impacts aren't apparent all the time, but what can be done is that employers can look at this as an opportunity and to invest in people's mental health support as a way to try and mitigate these impacts. Of course, we estimated that roughly 15% of the workforce will encounter one of these 5 big life moments over the course of a year. So that's a large group of the workforce. And so I think building these support networks and, as Bupa are doing, opening up mental health support centres can be a really important step to try and help alleviate some of these impacts.
Well, it's certainly important for those of us now on the job. We understand how much it can affect us, and post-COVID, it really has been interesting just to see the impacts on our everyday lives. Liam Daly, grateful to you for your insights. Appreciate it.